I can't go at it alone. Nobody can. And if I try to, I will likely fail. But if I have a great network of interested individuals, then I am more likely to succeed.
I think that's one of the advantages of having the 3-year cycle is the fact that you're not doing something that's a flavor of the month. You're not doing something that is a quick hit, a bright idea, a spark that goes dark. You're able to work with people who help you through that process and even nudge you a little bit, hold you a little bit accountable of, hey, here's the plan. How's the plan going? And I think it's those gentle nudges that remind you of, oh, okay, there are things we need to do for our long-term success, and making sure that the urgent doesn't overcome the important. I think that's one of the things that working with Delta over several years gives you that it's hard to get other ways.
I can get out and talk about the services that we provide and the different ways that we can make the community healthier.
So looking at that health over the lifespan and making sure people don't fall through the cracks, a lot of that is because of my background as a nurse. I really try and look at things in a different way, holistically, as opposed to just treating specific discrete elements of disease.
So what we're doing is through the healthcare system, meeting the needs, in addition to just going to the doctor, is actually educating how they can maintain a healthy lifestyle. Not everyone understands that. Some people believe that once they've been diagnosed with a condition, that they're just going to have to live with that condition, and there's not much they can do about it, except for go to the doctor and be prescribed more medicine. What this is doing is hopefully leading them to a healthier lifestyle where they aren't so dependent on medication, and that they can learn how to balance medication with healthy lifestyle choices.
So with the hospital and the community center, obviously we have the same goal in mind, and that's individuals' health, our community's health. Any opportunity that we have as a community center to put something towards our community members that can be done in partnership with the hospital seems like a perfect fit for us.
What needs do we need to be focusing on? I remember one of the questions asking, what do you feel like you need for you or your neighbor to be healthier? And one of the answers was healthier food choices. Well, they're out there, but then another answer was, I need somebody to explain to me food labels.
Mary and I, the community champion, are working on an initiative that will be rolling out soon.
Fresh Foods RX. And we're going to implement this program as a pilot first, trying to get people to eat more fruits and vegetables. We have a small grant for that, so I've gone to the local grocery stores to ask for their participation, and they're both willing and ready for us to do this. Their support's amazing, as always. It's Ste Genevieve. We can always count on the support of our community. It's just Ste Genevieve.
So we were able to work with the city, with the community center, and with the National Park Service to come up with a plan for how we could get grants and other opportunities to make Ste Genevieve a more walkable community for good health as well as for recreation.
And so we started having conversations about biking paths, hiking paths, pedestrian paths, anything that we can do to get people outside and be active and do it in a safe manner. And that's kind of where the conversation started, and then we engaged some community leaders with the county and city level to look at mapping our community, especially within the city limits, so people know that there's things that they can do in small groups but still accomplish the same goal of being outside and being active and being able to be involved with the community.
It's pretty wonderful, actually, to see familiar faces, to know generations of families. I've worked in the community all of my adult life and love this community, love taking care of the community.